Thank you all for joining. My name is Scott Kirshner, and I'm with America's Medicare Associates. And typically, what I do with these educational meetings is I will actually hold them in a classroom environment. But with the COVID-19 crisis and the social distancing, I've decided to put these webinars together, and hopefully, you can get some great information out of these webinars. I haven't done a lot of these, so this is relatively new to me. So be patient, and we'll hopefully get through this with some good information. So basically, the agenda today is very, very simple. Once again, I'm Scott Kirshner with America's Medicare Associates. I've been in the business for 26 years, helping people with their health insurance needs and specializing in Medicare. Those turning 65 or anyone that has continued coverage through an employer and retired after 65 and signing up, I can help with all of that. Today's presentation should be approximately 30 minutes. And what we're going to do is we're going to go over what important steps are needed to sign up for Medicare. And then once signed up for Medicare, we're going to go over the Medicare options you have for supplemental or Advantage plans. And then we'll also talk about your prescription options as well. Should anyone have any questions, I did include my office text number there at 419-909-3828. Or you can email me and I will reply to those emails. As always, you can contact me at my office at 419-794-3053, and I'd be happy to answer any questions you might have. So let's get started. So why use America's Medicare Associates and myself? Well, there are several advantages to using an independent agent like myself. One of them being there's no charge to you at all. There's no charge for any appointment. We don't charge a consultation fee. We are compensated by the insurance carriers that we place your coverage through for your supplemental or your Advantage plan. The premiums are all standardized. There's no upcharge because you use an independent agent. It's the same price whether you contact the company directly or whether you go through an agent. I am an independent agent. What that simply means is I am licensed in 3 states, Ohio, Indiana, and Michigan. We represent the top rated companies in all of those states. And I'm a non-biased advisor. I offer advice to you on a non-biased basis. I give you the information, I help you decide what's going to be your best option, and we move on from there. Being your permanent advisor simply means that I am here as the point of contact for you. You don't have to contact an 800 number, talk to a different customer service representative. You always have that option, but if you have a problem, you can contact myself or you can go directly to the company. One of the key things that I offer is annual reviews of all of your insurance. What you sign up for today may not be the best option for you tomorrow. And what I mean by that is we will perform annual reviews to make sure that the plan that you chose is still working the best for you and meeting all of your needs. So the healthcare puzzle, and it truly is a puzzle. As you can see, the yellow yellow piece of puzzle there is kind of the anchor holding all of these other pieces together. So let's get right to it. Once again, if you have any questions, you can text at the 419-909 3828. Once again, that's 419-909-3828. You can text any questions you might have, and I will do my best to answer them or find the answer for you if I don't know it off the top of my head. So Medicare, the yellow piece holding everything together. Medicare, original Medicare, comes in two parts. It comes in Part A for hospitalization, and Part B is your medical services. Once you sign up for Medicare, the first thing what will happen is you will, once approved, you will get your Medicare card. As you can see, the new Medicare cards actually have a number specific to each individual. Before it used to be a social security number, now it's an actual encrypted number for you. So original Medicare, what does it cover? So Part A is the hospitalization portion. Part A, as you can see here on this slide, Part A will cover days 1 through 60, all but $1,408. The $1,408 is your deductible or your out-of-pocket expense. Days 61 through 90, Medicare pays all but $352 a day. That means you would have to pay that. And days 91 plus, you would pay $704 a day. For skilled nursing, days 1 through 20, Medicare pays all approved amounts. This is a typo here. This is supposed to be days 21 through 100. You would pay $176 a day. Days 101 and beyond, Medicare pays nothing. You have to pay the balance. Now, there's one very key important item to remember about skilled nursing. You must come out of a hospital stay for at least 3 days before you can go into a skilled nursing facility and have coverage. This is very important. If you are in the hospital and you're in the hospital for 3 days, but the hospital and doctors are coding it as observation, there is no coverage for skilled nursing. So that's very important to be aware of. It must be a 3-day hospital stay other than observation, and then go directly to a skilled nursing facility and you will have coverage. Original Medicare for Part B, which is the medical services, comes with a premium, $144.60, unless your income is above a certain level, which we can talk about later or on a one-on-one. It's a family income of $175,000 or more, then the premium is going to be higher. So Medicare Part B, the medical services, you will have a $198 deductible. That is a yearly deductible. That is for medical Part B services. After the deductible, Medicare covers all expenses at a 80-20%, meaning you will be responsible for the 20%. There's no cap on that number. Okay, you're responsible for the 20%. And as you can see, it's physician services, inpatient, outpatient hospital care, speech therapy, diagnostic testing, durable medical equipment, emergency room, ambulance service, etc. So the important enrollment periods to keep in mind and be aware of. Once you turn 65, you fall under that first column over here, which is your IEP, or your initial enrollment period. It's a 7-month window. What that simply means is 3 months prior, the month of, and 3 months after your 65th birthday, you are eligible for guarantee issue. If you miss that 7-month window, then you are subject to penalties for Part B and for Part D, which is prescriptions. We'll talk about in a later in this presentation. The next category is the AEP, which would be your annual enrollment period. This starts October 15th and runs through December 7th. Now, what this period is for is anyone that might have a Medicare Advantage plan, you can change to a different plan or company during this period. Once again, with an Advantage plan, there's no medical underwriting. It's guarantee issue all the time. And then we move over here to the OEP, which you're all aware of is the open enrollment period. January 1st through March 31st is the open enrollment period. What this period is primarily for is anyone who has chosen a plan over here in the annual enrollment period, or even their initial enrollment period. During the open enrollment period, they can make a change to that plan. If they decide that the plan doesn't meet their needs, the prescription coverage isn't adequate, the network is not strong for their needs, they can change one time during the open enrollment period. And then over here, the SEP is the special enrollment period. That's for anyone with special needs or anyone that would have a special enrollment period would include losing coverage and being eligible for coverage other than the open enrollment or the annual enrollment periods. So, as I mentioned in an earlier slide, Medicare is an 80-20 plan. So the big question comes, how do I cover my 20% exposure? Well, the way you do that is you purchase a Medigap or Medicare supplement plan or a Medicare Advantage plan. On this slide, you can see that original Medicare has parts A and B. You purchase a Medicare supplement, and then you would have to purchase a prescription plan down here, Part D. That would be a standalone plan. On this side of the slide here, you see that a Part C, which is a Medicare Advantage plan, includes Part D, the prescription. And it is going to cover all of your Parts A and B and prescription with one plan. That is a Medicare Advantage plan. So kind of an overview. Medicare Part A, hospitalization, inpatient hospital care, and skilled nursing facility coverage. Part B is your medical expenses, your doctor services, hospital outpatient, home health care, preventative services. And then you have Medicare Part D, which is your prescription coverage. With an Advantage plan, you can see the funnel. Medicare Part A, B, and D are automatically included in an Advantage plan, and that is what's considered Medicare Part C. I know the government did a great job of making this as confusing as possible for all of us. So, how do you enroll? Well, that's a great question. In the way you enroll, there's a couple of things you want to be prepared for. The first thing I would do, and also I have put together a Medicare roadmap. And this Medicare roadmap basically lists some websites and the steps that are needed in signing up. So the first thing you want to do about 9 months, 7 to 9 months prior to turning 65 is you want to go out and create a My Social Security account. And you would do that through the Social Security website. This will determine whether you're even eligible for Medicare. Once you determine whether you're eligible for Medicare, then you will 2 to 3 months prior to turning 65, you would want to sign up for Medicare Parts A and B. Now, what you need to sign up is very simple. You need your Social Security number, your pertinent information, your name, address, birth date, Social Security number, and that information you would input into the website. I can assist with that. I've been helping people over the past couple of years go through that process. With the COVID-19 virus, the Social Security offices are all closed or have been closed. And so what I've been able to do is assist people with signing up for their Medicare Parts A and B online. And it works out quite well. It takes about 10, 15 minutes tops. So once you determine whether you're eligible for Medicare, you then sign up for Medicare. Once you get your Medicare card, you are then ready to sign up and enroll for a Medicare supplement or an Advantage plan. So got ahead of myself there. Why should you consider a Medicare Advantage plan? Well, there's several reasons why to consider a Medicare Advantage plan. Some of those include Medicare Advantage plans cover all medical and hospital services that original Medicare covers. It also covers the services that we were talking about, the 3-day, skilled nursing facilities. It covers that regardless whether you're in the hospital 3 days or not. So that's a good thing. An Advantage plan also will cover dental and vision and hearing benefits, along with prescription coverage automatically included, and it does have other benefits. It has gym memberships and other items that are very advantageous. So that's a good reason why to consider a Medicare Advantage plan. The other thing is typically a Medicare Advantage plan has a very low to no premium for this plan. So you can actually get a Medicare Advantage plan with a 0 premium. Some things to be prepared for and to be aware of. A Medicare Advantage plan is a network plan. What that simply means is you have to make sure that your hospitals and your doctors are in the network. Now, there are some companies out there that have nationwide networks. Those companies cover you while you're traveling across the countryside. Now, one thing that everybody is always asked a question, well, if I have a network plan and I travel and there's an emergency, what happens? All of these plans have emergency services regardless of where you're at. So if it's a medically necessary emergency care, you go to the emergency room, you've got coverage. So that's not something you need to worry about. You will have coverage for that. So why should you consider a supplement? Well, it's quite different than a Medicare Advantage plan. A Medicare supplement requires you to have Parts A and B, and you have to live in the plan service area. Now, what that simply means is you have to buy a plan in, say, you live in the Toledo area, or you live in Indiana, Angola, Indiana, or some city in Michigan. You have to buy a plan that's in that service area. Now, the nice thing about that is a Medicare supplement is not a network plan. So what that simply means, you can see down here at the bottom, there's no networks. Oops. There's no network. So you can go to any doctor, any hospital, anywhere that accepts Medicare. It is also guaranteed renewable. As long as you pay your premiums the plan will continue to renew every year. The other thing is the plan coverage will never change. Whatever plan you choose, like Plan G as in George is what most people are buying today. Plan G is the same coverage with every carrier out there. So it doesn't matter if you're going with Medicare Mutual or Paramount or Anthem or United or Humana, any one of those companies. If you buy Plan G, it is the same coverage with every company. So there's no difference in coverage at all. The plans are very comprehensive. With Plan G, the only out-of-pocket expense you would have would be $198 deductible. Everything else is covered under Plan G. So you can see that there are some differences. Here's kind of a summary. With a Medicare Advantage plan, lower premiums, typically low to no premiums. You will have out-of-pocket expenses. You could have anywhere from $4,500 to $6,500 out of pocket. It does come with office co-pays and emergency room co-pays, specialist co-pays. They're typically lower co-pays though. It does include prescription drug coverage. It does have a network requirement. And a lot of times there are extra benefits like vision, dental, and gym memberships, to mention just a few. On the other side, a Medicare supplement. Zero to low out of pocket. What that simply means is your out of pocket is capped at your $198 deductible for Part B if you choose Plan G as in George. There's no network coverage. The coverage travels wherever you go. You will have to purchase a separate prescription card, a standalone drug card. It is guaranteed renewable. You cannot be dropped from the plan, and the benefits never change. So you can see that there's some drastic differences with the two of them. So the next part of the puzzle is the prescription. So here's how Part D works. So basically you have two choices. Once again, if you purchase a Medicare supplement, then you have to purchase a standalone drug card. I can help you with that process. That's what I do. I go through that process. We input your medications into a Medicare.gov program, and it spits out what's going to be the best options for you. And I can help you interpret all of those coverages. Your other choice, if you choose a Medicare Advantage plan, it comes with a prescription drug coverage automatically, part of the program. So here's kind of a breakdown of how the drug coverage works. The initial coverage, you're going to have low to sometimes no out-of-pocket expenses. For example, your maintenance medications will have a copay, but they're very low copays. Some companies like Walmart or Kroger, I believe, some of these other drug pharmacies on the low maintenance drugs, sometimes you'll get them for zero copay at all. So the only thing you would pay would be your monthly premium for your drug card itself. So you can see here this number of $4,020. Once the cost of the drugs accumulates to $4,020, then you move into the next stage of coverage, which would be the donut hole or the gap coverage. Now, this is a change for 2020. While in the gap or the donut hole, you will pay 25% for generic and brand name drugs until you reach the threshold of $6,350. Now, keep in mind, this is the cost of the drugs. It's not necessarily what you pay. It is the cost of the drugs. Okay, so you pay 25% while you're in the gap or the donut hole. Once you exceed the 6350, you then move over into the catastrophic coverage. At this point, you're going to pay $3.40 for generic drugs or $8.50 for brand name, or 5% until the end of the calendar year, which would be December 31st. So these are your different tiers or stages that you would go through. So I know I've been talking a lot. I know I've kind of rushed through this. Don't want to keep you sitting in front of your computer any longer than you have to. But we've kind of went over a lot of coverage there. Once again, don't hesitate to text on my text office number or email me any questions you might have, and I'll get right back with you on those emails. But here are some of the potholes to overcome. It's very important to know your enrollment periods to avoid any penalties. These penalties will stay with you for the rest of your life as you have Part A and Part D. Another very important thing to keep in mind is if you determine that a Medicare Advantage plan is the best option for you, it's imperative that you verify the networks for your hospital and your doctor's offices. Make sure that they take your plan of choice. The worst thing that could happen to you would be you have a serious illness, you go to your doctor, and then you find out that there's no coverage because you're out of network. So it's very important to go through and verify that your doctors and hospitals are in the network. That's what I do. That is my job, to make sure that we avoid these potholes. So that's the healthcare puzzle as we see it today. There are lots of moving parts in this, and I just wanted to, hopefully you got something out of this. I wanted to go through all of this and make sure that if there's anything that I can help with, I put that information out there for you. So what's next? Well, the next step would be this. I would be more than happy to help you with the process. I can help you determine whether you're eligible for Medicare. I can help you sign up for Medicare's Part A and B. I can, once that process is complete, I can then assist you in signing up for your supplemental policy, whether it's a supplement or an advantage plan. I also assist you with your choosing a prescription plan that's going to best fit your needs. Once again, I've been doing this for 26 years. I have a true passion for helping people navigate through this. It's a very confusing, intimidating, stressful time, and it shouldn't be. You turn 65, it's a milestone. It's a great time for everybody, and you don't want to have to worry about signing up for Medicare and making sure you don't click the wrong box and have the people knock on your door to haul you away to jail because you signed up for the wrong plan. We can eliminate all of that. Like I said, I've been doing this for a long time, and I understand working with my parents. I've gone through this with them for the past almost 20 years now. And back when they started with this, there wasn't anybody out there doing the meetings like we have today. And uh, as a result of that, I've started these meetings and really helping out people. So hopefully you learned something. Feel free to reach out to me. Call me at 419-794-3053 to set an appointment, or you can email me directly. I hold one-on-one meetings. I can meet you if you're okay with a face-to-face meeting. I know things are starting to change a little bit with that. Something new that I've been doing is working out quite well is I will hold a Zoom meeting where we can actually we don't have to meet face to face, but we can actually log into computers and go through. I share my screen so you can see the whole process and we can walk you through that. I can do over the phone applications and sign you up over the phone and with emails and things of that nature. So once again, you see my number there and you've got my email address here. Please reach out and let me know how I can help you. And if anybody has any questions, text again at 419-909-3828 or reach out to my email or call me. Thank you again for joining this webinar. Hopefully you got a lot out of this. And if any of you would like to learn more, watch for more webinars coming up. And thank you very much and have a great day.